Welcome to a patient information video for chronic spontaneous urticaria. Today we will cover what it is, why it happens, and what we can do about it going forward. Disclaimer: this video is for patient education only and should not be taken as medical advice. Please check with your healthcare provider. What is chronic spontaneous urticaria? Urticaria is a term used for hives, which are raised areas of skin that can feel itchy and are pale in the middle. Histamine release in our body can be associated with swelling of the deep layers of our skin and tissues, which we define as angioedema. Chronic urticaria is defined as hives and swelling occurring most days for a period longer than 6 weeks. In contrast, hives that only occur for less than 6 weeks are called acute urticaria. Today we will focus only on chronic spontaneous urticaria. So what causes it? If chronic urticaria has a trigger, we call it physical urticaria. Examples of triggers include cold temperature, sweating, vibration, exercise, and sunlight. If there is no identifiable trigger, then it is called chronic spontaneous urticaria. To understand the symptoms, we need to take a closer look inside. Our body have allergy cells all over. These are called mast cells. Mast cells play a role in our immune system, and they are a storage unit for several chemicals, one of which are histamines. The histamine is locked in the storage unit with a lock and key type mechanism. The lock is what we call a receptor, and once the receptor is activated, the histamine is released into our body. The release of histamine can lead to hives and swelling. There are two main mechanisms by which we believe the histamines are released in chronic spontaneous urticaria. The first defect is due to a miscommunication that happens within our cells, or a defect in the intracellular signaling. The second mechanism of CSU is autoimmune mediated, meaning some sort of problem in our own immune system leads to opening mast cells and releasing histamine. This can be thought of as a key problem, where the wrong keys are able to open the lock. In the autoimmune theory, there are two main perpetrators. There are self-antigens or molecules made within our body that activate our allergy receptors and release histamine, or there are antibodies, i.e. security personnel, that act on these receptors unlawfully and release the histamines. Are you at risk of other autoimmune diseases? Yes, chronic urticaria can be associated with other autoimmune diseases. 27% of those with CSU have thyroid disease. CSU itself does not lead to end organ damage. Just because you have CSU, it does not mean that you will develop another autoimmune disease. It just means that you have a higher likelihood of developing another autoimmune condition compared to the general population. Do I need extra labs? In most cases, there is no testing required for CSU. Skin testing can help rule out other allergic conditions. Blood work is only necessary in severe or atypical cases of CSU. Does it go away? In most patients, CSU is episodic and self-limited, usually lasting 2 to 5 years. In other words, CSU will burn out on its own. Treatment will alleviate the symptoms. How do you treat it? It is recommended that CSU patients avoid alcohol, opioids, and non-steroidal anti-inflammatories, as this can worsen symptoms. These things are like fuel to the fire and could exacerbate a flare of your CSU. The main treatment includes medications that are called non-sedating antihistamines. These antihistamines block the receptor so that it can get activated. Basically, the lock is occupied and other keys cannot open it. Examples of non-sedating antihistamine medications include cetirizine, loratadine, bilastine, rupatadine, etc. When these antihistamines are not as effective, we can increase the dosage up to 4 times the regular dose. If there is no improvement, you should be seen by an allergist to consider biologics such as omalizumab or other medications such as cyclosporine, montelukast, and steroids. What about Benadryl? The Canadian Society of Allergy and Clinical Immunology recommend against older generation antihistamine, including diphenhydramine, best known as Benadryl, because they have lots of side effects and it could result in death from accidents, overdoses, and even sudden cardiac deaths. In short, always use non-sedating antihistamines. Can a low histamine diet help? No. Food avoidance is not helpful in CSU. What do I need to watch out for in CSU? If the hives scar, bruise, or last for more than 2 days, you should speak to your doctor. Also note any abnormal symptoms such as weight loss, fevers, or sweats. These types of symptoms are not typical of CSU. This concludes the video for CSU. If you have further questions, please visit www.chronicurticaria.ca for further information. Thank you for watching. Until next time.